Ever experienced that sudden twist or roll of the ankle, leaving you wondering if it's just a minor sprain or something more serious? Hi there, and welcome back to our channel. Today, we're diving into the world of ankle joint pain, exploring the common dilemma of sprains versus fractures. So, you think you've sprained your ankle, but what's the next step? Do you rush to the doctor's office or wait it out at home? And speaking of home, what can you do to ease the pain and prevent further injury while you recover? But wait, what if it's not just a sprain? What if it's a fracture? How do you differentiate between the two? Join us as we unravel the mysteries of ankle joint pain, offering insights, tips, and advice to help you navigate through this discomfort. Whether it's a simple sprain or an unwelcome fracture, we've got you covered. Stay tuned as we explore about ankle injuries right here at VitalityVortex channel. Make sure you watch this video until the end and leave your comments below. So when you twisted that ankle, what are the signs and symptoms you would expect after that unfortunate accident? Let's talk about it. Pain. Ankle sprains typically cause immediate pain at the site of the injury. The pain may range from mild discomfort to severe, sharp pain, depending on the severity of the sprain or if it is a fracture. It's often felt around the ankle joint and may radiate to the surrounding areas. Swelling. Swelling around the ankle joint is a common and visible sign of an ankle sprain. The swelling may develop rapidly after the injury and is caused by the body's natural inflammatory response to the trauma. It can make the ankle appear swollen and puffy. Bruising. Discoloration or bruising may occur around the ankle due to bleeding under the skin caused by the injury. The bruising may appear red, purple, blue, or black, and may spread over time. It's a result of blood vessels being damaged during the sprain. Difficulty walking. Ankle sprains can make it challenging to bear weight on the affected foot. Walking may be painful or limited due to instability and discomfort. People with severe sprains may find it almost impossible to put any weight on the injured ankle without experiencing significant pain. Tenderness. The injured area may feel tender to the touch, especially around the ankle joint and along the affected ligaments. Pressing on the tender areas may exacerbate the pain and discomfort experienced by the individual. Instability. Ankle sprains can lead to feelings of instability or a sense that the ankle is giving way, particularly when trying to stand or walk. This instability is due to the stretching or tearing of the ligaments that support the ankle joint, leading to reduced stability and increased risk of further injury. And now that you injured your ankle, whether it's a sprain or a fracture, what can you do to manage your symptoms at home? By incorporating these home management strategies into the treatment plan for an ankle sprain, you can effectively alleviate symptoms, promote healing, and prevent complications. Rest. Resting the injured ankle is crucial as it allows the body to focus its energy on the healing process. By avoiding activities that exacerbate pain or discomfort, you can prevent further damage to the injured ligaments. In severe cases, using crutches or assistive devices may be necessary to offload weight from the affected foot and promote optimal healing. Ice. Applying ice packs or cold compresses to the injured ankle helps reduce swelling and alleviate pain. Cold therapy should be initiated as soon as possible, following the injury to constrict blood vessels and decrease blood flow to the injured area. This helps limit inflammation and prevents excessive swelling. Ice should be applied for 15 to 20 minutes every few hours during the initial 48 hours after the injury. It's important to wrap the ice pack in a cloth to protect the skin from frostbite and avoid direct contact with the skin. Compression. Utilizing an elastic bandage or compression wrap is beneficial in reducing swelling and providing support to the injured ankle. The compression wrap should be applied snugly, but not too tightly, to avoid impeding blood flow. Proper compression helps control inflammation by exerting pressure on the injured tissues, which minimizes excessive fluid accumulation in the affected area. This also helps stabilize the ankle joint and reduces the risk of further injury. Elevation. Elevating the injured ankle above the level of the heart is an effective way to reduce swelling and promote drainage of excess fluid from the injured area. Propping the foot up on pillows or cushions while resting helps maintain elevation and should be practiced consistently, especially during the initial stages of injury recovery. Elevating the ankle allows gravity to assist in fluid drainage, thereby reducing swelling and discomfort. Pain relief. Over-the-counter pain medications such as ibuprofen, Advil, Motrin, or acetaminophen, Tylenol, can provide effective relief from pain and discomfort associated with an ankle sprain. These medications help alleviate pain by reducing inflammation and blocking pain signals in the body. It's essential to follow the package instructions for dosage and avoid exceeding the recommended limits to minimize the risk of adverse effects such as gastrointestinal irritation or liver damage. While many ankle sprains can be managed at home, it's essential to seek medical help if you have the following symptoms to be sure, so we can rule out any red flags, including important fractures. Severe pain. If the pain is severe or does not improve with home treatment, it may indicate a more serious injury, such as a fracture or severe ligament damage. Persistent, intense pain that limits mobility should prompt a visit to a healthcare professional for further evaluation. Inability to bear weight. If you are unable to put any weight on the injured foot or experience significant instability when trying to stand or walk, it may be a sign of a more severe sprain or fracture. Difficulty bearing weight on the affected ankle warrants medical evaluation to rule out more serious injuries. Persistent swelling or bruising. If swelling and bruising persist or worsen despite home treatment, it may indicate a more severe injury that requires medical attention. Prolonged or excessive swelling and bruising may be signs of underlying ligament tears or fractures that need to be assessed by a healthcare provider. Limited range of motion. If you experience significant difficulty moving the ankle or notice any deformity, it may indicate a more serious injury that requires medical attention. Limited range of motion in the ankle joint may be due to ligament damage, tendon injury, or bone fractures, all of which require proper evaluation and treatment. Numbness or tingling. Numbness, tingling, or loss of sensation in the foot or toes may indicate nerve damage and should be evaluated by a healthcare professional. These symptoms may occur with severe ankle sprains or other injuries that affect nerve function and require prompt medical attention. So after seeking medical help and important fractures were ruled out, as a bonus part on this video, we will talk about rehabilitation. We have to understand the sprain and future risks of recurrence and long-term complications. Severity grading. Ankle sprains are often classified based on their severity, typically categorized into 3 grades, such as grade 1, which is a mild sprain with minimal ligament stretching and no joint instability. Grade 2, moderate sprain involving partial tearing of the ligament and mild to moderate joint instability. Grade 3, severe sprain with complete tearing of the ligament and significant joint instability. Rehabilitation exercises. Once the initial acute phase of the injury has passed, rehabilitation exercises are crucial for restoring strength, flexibility, and range of motion to the injured ankle. Physical therapy may be recommended to guide individuals through a structured exercise program, tailored to their specific needs and goals. Prevention strategies. Implementing preventive measures can help reduce the risk of ankle sprains in the future. This may include wearing supportive footwear, using ankle braces or tape during physical activity, performing ankle strengthening exercises, and practicing proper techniques for landing and pivoting during sports or activities. Return to activity. Gradually returning to normal activities in sports after an ankle sprain is important to avoid re-injury. It's essential to progress slowly, gradually increasing the intensity and duration of activities as the ankle strength and stability improve. Consultation with a healthcare professional or sports medicine specialist may be beneficial to ensure a safe and effective return to activity. Seeking medical evaluation. While many ankle sprains can be effectively managed at home, it's essential to seek medical evaluation if symptoms persist or worsen despite conservative treatment. Additionally, individuals experiencing severe pain, significant swelling, inability to bear weight, or signs of a possible fracture should seek prompt medical attention to rule out more serious injuries and receive appropriate treatment. Long-term complications. In some cases, untreated or poorly managed ankle sprains can lead to chronic ankle instability, recurrent sprains, or other long-term complications. Early intervention, proper rehabilitation, and adherence to preventive measures are essential for minimizing the risk of these complications and promoting optimal ankle health. Thank you for watching, and remember to prioritize your ankle health for a speedy recovery and long-term well-being. If you found this video helpful, don't forget to like, share, and subscribe for more informative content on health and wellness. Click that notification bell so you don't miss an update. Leave your comments below and stay safe.